Thank you very much, Dr. Price. I want to thank the Society for the opportunity to present our experience in surgical education, and for you, all the last standing survivors that are still with us in this session. What I'm going to show you today, besides the program in education in laparoscopic surgery in Mexico, is a personal dream. I have nothing to disclose. And when you think what's stopping you from dreaming big and setting goals, you're looking here at two persons that are very important to this project that I've made. I have to be sincere with you in a bar in Washington. And from that talk and sharing our dreams, a lot of this project has come together. Mexico is a country with many different countries within. And for instance, this is the hospital that I work with in Mexico City that even has a robot. But in the further provinces in Mexico, there's poverty and the hospitals are not well equipped. And we estimate that only 20% of procedures are done by many minimally invasive techniques. And the reasons being, there's no opportunities to get further education in laparoscopic surgery, and there's no resources to equipment of laparoscopy in the country. I represent now the Mexican Association of General Surgery, which mission is to provide continuous educations, update in knowledge and surgical education to general surgeons in order to establish better surgical practices favoring patient safety. And maybe you will feel identified with what is happening with us in the ORs in Mexico.
Tranquilo, vamos a operar ahorita.
¿Con quién vas a operar, güey?
Ay, me tocó este residente inflado, ¿cómo se llama? Prieto, Rodrigo Prieto.
Madre santa.
Madre santa, pero ahorita lo voy a agarrar, lo voy a exprimir, vas a ver. Si de veras quiero operar conmigo.
Pero duro.
Pero durísimo. Te veo al rato, Miguel.
Bueno.
Cuídate.
Te mira.
¿Qué pasó, Rodrigo?
Tenemos una pacientita en urgencias, doctor.
Ok, a ver, preséntamela.
Es una mujer de 24 años de edad que tiene dolor abajo de la costilla del lado derecho.
¿Cómo se llama eso?
Tiene un signo de Morphy positivo al lado de la palpación.
Ok. ¿Y si es ultrasonido?
Sí, se lo solicitamos, doctor, y nos reportan varias cositas que coinciden con una colecistitis.
¿Cuáles son los datos ultrasonográficos de colecistitis aguda, Rodrigo?
Pues mire, cuando le pasaron el transductor para arriba tenía dolor en el sitio de donde está la vesícula, tiene un Morphy ultrasonográfico y también tiene la pared de más de 5 milímetros, está repleta de litos y parece que tiene un poco de edema alrededor de la vesícula.
Ok, no estás tan mal, te voy a dejar que lo operes.
Muchas gracias, doctor.
¿Cuántas has hecho de estas?
Pues es la quinta, doctor.
Pues no, parece la primera, no tienes idea. A ver, Rodrigo, ten cuidado con esa mano. No, ahí no, Rodrigo. No le cortes ahí. Síguele, con calma.
Ok.
Síguele, pues, si sigues así te lo voy a quitar, ¿ok?
Ok. Ahí voy, doc. ¿Cómo ve?
Bien, ¿cuántas has hecho?
Como 5, doc. ¿Qué le parece?
5. Sí. Lo veo perfecto, Rodrigo. ¿Sabes qué? Me voy a echar un café. Si te atora algo, me avisas, ¿de acuerdo?
Está bien, doctor.
Suerte,
está bien.
suerte.
Gracias.
So we have different ways of training people, really, depending on the expertise of each professor. And the other problems we have, if you look at the OECD numbers of how many doctors should be available in a country to be the standard worldwide, in Mexico, we are below that standard. And when it comes to surgeons, we have a very low Mexican board-certified group of surgeons, what puts us really in problem. Most of these surgeons are located only in few places where the main cities and equipped hospitals are, and all these surgeons, and it's almost in 80% of urban cities, but in the rural scenario, only 2.3 of surgeons are taking the post. Of these surgeons, 30% work in private sector and almost 70% work in the public sector. And this is so striking. If you look at the numbers in the high column, these are the numbers of medical students trying to apply for a position in a residency program. These are the ones sustaining actually the test, and these are how many are accepted per year to do further training, which is really low. So when you look at what can we start and what can we do in helping training Mexican surgeons, you feel a little frustrated. So being in the Association of General Surgery, I started to think that there's limited opportunities to get further training. There are limited courses capacities and the cost is increased. And we need laparoscopic surgeons to take care of Mexican patients. Current opportunities to get further education in minimally invasive surgery after residency or fellowship in Mexico, you need to attend the annual meeting of my society, sign for hands-on workshop. Of course, you have to travel for the expenses of housing. You have to pay for traveling expenses, housing, and food. And we have another problem. In these meetings, we offer courses on basic laparoscopy, advanced biliary surgery, anti-reflux surgery, colorectal surgery, bariatrics, and advanced hernia surgery. The problem is that we have big responsibility delivering these courses because sometimes there's false expectation on complex procedures. There's lack of follow-up of these trainees. And we know that the results depend on proper training and delivered practice. We might be contributing to increase the complication rate, and we assess that we're in need for an educational model. And we think that we are maybe giving these people licenses to kill if we are careful how we train them. So that's why we turn around and look at SAGES. Why SAGES? Because their mission and their vision is very similar to what the Mexican Association of General Surgery. We did a joint venture of collaborating partnership between the both associations to standardize training and educational laparoscopic to deliver high-quality patient care in minimally invasive surgery in Mexico. Why is SAGES collaborating with Mexico? Because we have several similar needs, several similar concerns. Laparoscopy adoption rates lag, conversion rates remain elevated, and minimally invasive surgery and identifying bulk injury and injuring it, it's a problem. Infrastructure is in place in some of cities in Mexico, and the educational commitment with training facilities and leadership is still at large. Engagement by professional organizations like the Mexican Society of General Surgery is granted. We are doing this through a SAGES program called Enduring Education. And we're in a phase called the ILAP project, which looks at skills, teaching skills for high quality care, and laparoscopy procedures and principles. And we're training educators to ensure local educators to ensure sustainability and introduce educational tools and methods in Mexico. In April 2016, we did an implementation pilot course, an intensive two-day course training the trainers, an intensive two-day course of safe laparoscopic cholecystectomy supervised. We did evaluations, personal feedback, and debriefing. We trained 80 surgeons of 9 different cities of the country, which would become the new local champions. These are the 9 areas of the country that the association is devoted to open as learning centers. And through the Endurance Education Program, we first visualized the mental surgical program needed. And to get to this point, we need to establish our needs, do it through needs assessment, then define our goals and objectives, determine an educational strategy, implement local faculty development simultaneous with skills training, and assess, evaluate, and provide feedback. This is the course agenda that we start with very important simulation-based education. You can see here all the subjects that are taught during this 5-day course. And at the same time, we're running the Safe Cholecystectomy program that has basic subjects like safe cholecystectomy, abiding commobile injury, diffuse course, access, troubleshooting, post-operative care, and live operative mentoring. Basically, what we are doing is we are trying to implement the safe cholecystectomy program taught by SAGES. And this program, we took it to the Mexican Senate last year, basically to tell our senators that we don't have more laparoscopic surgery in the country because there are no more educational opportunities, neither we have more resources. We don't know what is gonna come out of that, but here in the United States, it did some impact, and in the SAGES bulletin, this was published about the visit of SAGES faculty to the Mexican Senate. Then we went to Guadalajara. The big boss delivered a talk of the compromise of teaching laparoscopic surgery in Mexico, and at the same time, we opened the first learning center in Guadalajara with Dr. Rodrigo Prieto being the coordinator here. Due to the hard work of Rodrigo, we even got to go to the Guadalajara local TV to show our project. We went out to eat tortas ahogadas, which is a delicacy of the region, and we had a lot of fun doing this course. We even had the chance to use an electronic database platform called Sigma that we started to use as an opportunity to register all the outcomes of our program. Then we went to Mexico City to do a second course in this military hospital. And while we were delivering the course, the earthquake struck.
Se cayeron edificios.
And this is a vision from the hospital that we were where you can see how many buildings came down as we were working in the hospital. After this, we didn't know what to do, either stop the course and go home. And I thought my friends from the United States were going to run back to their country. But it didn't happen. We stayed there. We went to the Red Cross that was very close of the military hospital. And we could not operate on people, but we started to help the people at the Red Cross packing things and selecting all the materials needed to take care of injured people. And then we continue with the course, and I have no words to thank my friends from SAGES to help us in aiding Mexican people through these hard times. Lastly, we went to Orizaba like a month and a half ago to open the third learning center, which was a success. And in this center, we even have the opportunity to teach people how to do a low-cost simulator because they were complaining that they could not get the fancy simulators that we brought to deliver the course. Here's Kathy Bernes showing them how, with a box and a cell phone, do a simulator, low-cost simulator. And there's data out of these projects that I don't have time to go with detail through it, but basically shows the experience of the residents and the faculty in terms of the kind of procedures, laparoscopic procedures that they're familiarized with. And here is very interesting. We ask the residents and the faculty what they think in terms of sufficient feedback from faculty support to residents, the interpretation of education, if the faculty create a safe learning environment, and in red you see what the faculty thinks, and in blue you see what the residents think. And here is the face of the faculty when Kathy Vernet was telling them that they were not doing such a good job. This is just to show you 3 months after the courses, how much they have improved in all of these areas, and the residents felt a lot better after undertaking this, and this is comparing Mexico City faculty and residents. It's pretty much the same result. I'll go quick on this. Here's how residents and faculty have done the pre-course needs assessment and how they have come along by looking at 3-month results and how they improve in deliberately practicing. And the conclusion of this is that Mexican patients deserve better minimal invasive surgery in order to have better surgical outcomes. Further surgical education and limited resources are responsible for low rate of laparoscopic procedures undertaken. The Mexican Association of General Surgery is compromised to bring sound surgical minimally invasive education to Mexican surgeons. The SAGES ILAB project of enduring education is our tool. We'll be inducted through 9 learning centers where we are educating local champions, and data collection will help to further determine the project success. Here are the numbers of a lot of people I have to thank. I knew I was going to forget someone, and Javier was sitting there, and I think she's left right now. But I don't have words to thank enough all these people that has helped us in the project. And I told you these 2 people were very important. J.Q. Narvaez, the boss, and Diego de Diva Camacho. We were the ones dreaming about this 3.5 years ago, and we finally are working on our project, so keep on dreaming and helping your fellow countrymen. Thank you.